Hello, my name's David Walker. I'm Emeritus Professor of Paediatric Oncology at the University of Nottingham. I've worked for the last 30 years in the field of paediatric neuro-oncology, and I was the principal investigator applying for a grant from Children with Cancer, the UK Children's Cancer Charity, to develop the Children's Brain Tumour Drug Delivery Consortium. This poster has been produced by the consortium, and I've been working with Rumen Rahman, who's now the principal investigator for this grant, and is being led by Christian Aquilina, who's a consultant paediatric neurosurgeon at Great Ormond Street Hospital, and also a member of the ITCC brain tumour group within Europe. As you all will be aware, that brain tumours account for 20% of children's cancers and are the biggest cancer killer in childhood and young adults. The challenge of treating brain tumours involves overcoming the problems of delivering therapy to the central nervous system, whether it be surgery, radiotherapy or drug therapy. We're particularly interested in drug therapy and are acutely aware that many of the drugs that are effective in cancers outside the brain have limited effect because of the interference of the blood-brain barrier in their delivery to the tumour tissue. With this in mind, the consortium set up a programme of discussion of different drug delivery techniques that could be selected to try and overcome the problems of children's brain tumours. And these included discussions of intrathecal or intra-CSF chemotherapy, ultrasound-mediated blood-brain barrier disruption, convection-enhanced drug delivery to the tumour interstitium, polymer nanoparticle development, electric field therapy, intra-arterial chemotherapy, and intranasal or transmucosal chemotherapy. And there may well be other techniques that will develop as research progresses. Despite these options for drug delivery, there have been very few trials set up to investigate their role in children's brain tumours, or indeed in adult brain tumours. This consortium was set up to explore these possibilities and to try and develop collaboration between the various research elements to accelerate their progress. With this in mind, early in this year, on the 1st of March, we held our first clinical trials working group via an online meeting involving 38 leading brain tumour research scientists and clinicians from the UK, Europe and the United States. In our discussions, we identified that there was a lack of specific funding for prototype development to allow us to scale up the techniques for clinical trials. There were difficulties in navigation of the regulatory landscape with both techniques and new drugs and the application of old drugs in a new way. There was a lack of accurate preclinical models to simulate the use of such techniques, and there was an increased need for multicentric working to accelerate progress. There was widespread understanding that funding for such developments was not easily available, that the regulatory legislation was complex, and the funding models and industry links needed to be further developed. So as a result of these discussions, we proposed that we should run a workshop in Nottingham in November of this year, where we will try and develop a scaled up roadmap to help us understand how we can take such drug delivery concepts to clinic and through clinical trials. And this meeting is being planned for November. We're encouraging people to apply to join the workshop and contribute to the discussions. This consortium is co-funded by Children with Cancer. The manager of the consortium is Emma Campbell, without whom we could not have developed the consortium scope, the website and these plans. And we're working closely with the leaders of the ITCC in Europe, with Christian Aquilina, and also working with colleagues across the spectrum to try and ensure that this collaboration will bear fruit and develop trials of great value for children in the future. We invite you to join the workshop, and we look forward to meeting you there. Thank you very much.